Hello everyone and welcome to the second episode of the Listening Events podcast series. Our topic today is Women in Medicine. My name is Viola and I'm one of the acute medicine registrars in the Trust. We have got Louise Wells, who's a consultant in paediatrics and TPD.
Hello.
We have got Saiqa, who's one of Foundation Year 2 trainees in the Trust.
Hello.
And we've got Andrew, who's one of the paediatric registrars in the Trust.
Hi there.
Now, we'll cover a few topics, and one of the topics we'll start off with is gender bias and workplace culture. Now, I'll start with you, Saiqa. Do you think that female doctors have a different experience than our male colleagues?
Unfortunately, yes. Personally speaking, since med school, I remember once asking one of my anatomy profs for advice, and I went with a male colleague. She started telling me how I should freeze my eggs, how and who I should marry. And I said I just wanted career advice, and still to this day whenever I go and see a patient I still get asked am I the nurse or I'm waiting to see a doctor. I'm like, I've seen you. So yes, unfortunately a little bit, yeah.
As for you, Andrew, have you experienced any similar situations, or have you witnessed your female colleagues being treated differently?
Yeah, I certainly haven't experienced that myself. I never get asked if I'm the nurse. I get supposed to be the doctor. I've had patients turn to me and speak to me directly when they've been addressed by a female consultant. I've had nurses come behind the back of colleagues of mine who are women, international medical graduates, to double check plans, to find reassurance, in my opinion, when the plan made by the junior was perfectly reasonable or sensible. There was no reason to check it, and got looks from colleagues who are concerned that something may be awry when it's not.
So it appears to be that there is still quite a lot to be done to shift that culture at work, in the workplace, and in the way that male and female counterparts are treated in the workplace. Which brings us quite nicely into topic around work-life balance. And I guess my first question is to you, Louise, as we've trained at different times, and as a trainee, how did you juggle training and home life and just going through your career?
So when I first, so I've got 4 children, and I'd had one as a consultant, 3 as a registrar, and I came back to work full-time after my first one, and then less than full-time after that. And I think things have changed over the years, so some of which have helped work-life balance, and some things make it more tricky. So the rotas have changed. The rotas, whilst we, nowadays people train to do far fewer hours, the hours are much more unsociable, much more broken up, so actually that has a significant impact. I think being able to work less than full time is more common for many different reasons now, but obviously that belongs to your training, and maternity leave is significantly extended, and whilst that's great and you can have up to often 14 months off, that has a significant impact on coming back to work, and on your childcare, where children are often much more difficult to settle into new childcare environments when they're a little bit older. So things have changed. Some of them have been positive. Some of them are, they've got other components to them as well.
Hearing that as you're going through your training, I'm saying, how does that make you feel?
I think it's really nice. It's quite inspiring to hear, because you don't hear that very often. It's very much like you have to go, and then as a female you feel like you have to work twice as hard anyway to even get noticed. And there is that fear, especially I think within surgery, to sort of think, oh gosh, can I take time out? Do I need to keep going just to keep up? But yeah, so it's nice to hear that there is that option.
And from your perspective, Andrew, you're a less than full-time trainee, you've got little ones. How did that work for you, for the family unit and for your training?
Yeah, I've got 2 young children, and working less than full-time has given me the opportunity to spend more time with them, be a bit more around the house and spend more time with the family. Working shifts, you find that you might have more weekends at work, but you get more time off in the week, and while they're little, that's been really nice to have that time. My wife's a nurse, and so working and balancing shift patterns and competing interests is a challenge, but we make it work. And it may mean that I spend longer in training, but if somebody's going to have to spend longer in training to look after children, and it should equally be split between parents. That's much more equitable.
Which leads very nicely into career progression with, working less than full time, how that affects our careers as we progress through. Saiqa, how do you feel your own career progression has been impacted because you're a female doctor?
I've had quite a few challenges, especially going into theatre. There's always that sort of big surprise that I actually want to do surgery, and that sort of assumption that, you know, I think also it's because of my ethnicity as well. It's like, oh, surely you want to do general practice or obs and gynae, and it's like, no, actually I don't. So I've had a few challenges there, but on top of that, I think just generally as trainees at my stage at the moment, we have the additional challenge of more of us and fewer training places. So we're forced to take F3s, F4s, sadly. So it's a difficult time, unfortunately. So, yeah.
All right. And in comparison to that, Louise, how do you feel? Do you feel that there's a shift in terms of especially women in surgery?
So I think it's interesting, isn't it? I think we don't see many role models necessarily in surgery to the same degree. But one of my very good friends, she's a colorectal surgeon, and she's got 5 children, and she works with a team of 10, and of those 7 are women. So I think there are women, and you know, training is a challenge at the moment. But I think there's hope.
And it's so important to be able to see that representation in the senior positions, to encourage people to be able to go through and to ask questions as well.
Speaking of women in surgery, very recently the Royal College of Surgeons published a series of surveys that were taken in looking at the safety of women at work, and we had some harrowing stories about some of the sexual aggressions that our female colleagues are experiencing. Do you think that things have improved, Saiqa?
I think it's very positive that we're talking about it openly, and so many senior surgeons have spoken about their experiences, which makes it easier for the rest of us to talk about it. However, it's still very difficult at a junior level because you just want to keep your head down, and actually it feels like a bit of an honour to even be allowed into theatre, and you know, someone willing to teach you. But yeah. It's nice that it started, and hopefully it'll get better with time.
And on the back of that, very recently, the Trust introduced their Sexual Safety Charter. Are you aware of the Charter, Andrew? Have you heard about it?
I wasn't aware of the Charter, but I am now, and I think more needs to be done to make it accessible and read by people that work here. I think that things have improved in terms of raising concerns, but I do feel that there's not enough done in terms of addressing those concerns, and more needs to be done moving forward in terms of believing the victims.
Okay. So we've talked about quite a few topics that affect women in the workplace. We've talked about gender debate, bias and workplace culture, and the work-life balance, career progression and sexual safety. What changes would you like to see or make yourselves to change and shift this culture? We'll start with you, Louise.
I'd like people to focus on the journey rather than the destination, and recognise that although working less than full time will make your career as a registrar, you know, as a resident longer, for many people that's exactly the right thing.
How about you, Saiqa?
I think we're in a difficult time, unfortunately. What I would like to see is increase in training numbers, and UK trainees obviously getting priority for the training, and just the recognition of women that we belong in surgery too, and have that sort of equal right to be there. So that's what I'd like to see.
How about you, Andrew?
I think I need to work better at challenging unacceptable behaviours when I see them, and making a conscious effort to do that. I've started speaking to medical students when they come through about the different experiences that they might go through in terms of gender discrimination, and race-based discrimination as well. And I think I need to do more with that and encourage others to do that as well. I'm encouraged seeing more men working less than full-time, and I think that needs to improve to give it a more equitable balance of work-life balance for both men and women. We'll see a better shift in the workplace. And I think we also need to believe victims when they speak out about sexual violence or aggression.
So we've talked a lot about different topics, and it's been really interesting hearing all our different opinions of how all of these factors have changed with time, and hopefully as we continue to talk more about these issues, things will change. And like you said, Saiqa, you know, we can make the point that women do belong in medicine and women do belong in surgery. So thank you all for your contributions, and that concludes this episode. Thank you.
Thank you.
Thank you.